My name is Dr. Flavia Mpanga. I'm a health specialist in the Uganda country office, UNICEF Uganda country office, and I'm the focal person for the Regional Gates Initiative. The Regional Gates Initiative has been rolled off the ground since July 2015, and we are operational in three districts in the country. What the initiative has really empowered us to do is to develop platforms that district health officers and the district health management team can use systematically to develop evidence-based plans and to monitor them more regularly than they could have previously done, and to make corrective actions along the way. We've developed what they call the RMNCAH scorecard with a list of 24 indicators that have been agreed nationally to monitor maternal, newborn, child and adolescent health programs. And because we have real data coming in on a monthly basis, we can see how how performance is changing on a monthly basis. It has empowered the district health workers, the district officials, to be able to monitor their plans and to sit down and discuss what is not going well. We are in the process of generating bottleneck analysis platforms that will be embedded in the DHIS2 as well. So the scorecard, the RMNCH scorecard, is automatically generated in the DHIS2. So all the districts have to do is to ensure that their HMIS data is entered regularly, and is complete and of good quality. And once that is done, the scorecards are generated on a monthly basis. They use these scorecards to start doing what they call a bottleneck analysis. We are in the process of developing the bottleneck analysis graphs, so that those are automatically generated, so they can easily see where the bottlenecks are. Is it a human resource issue? Is it a commodity issue? Is it related to geographical coverage for a certain intervention? It could be immunization. Is it related to something to do with demand? Is there sufficient demand from the communities for instance, for an immunization program, for antenatal care? And when the citizens come for antenatal care, do they complete their 4 antenatal care visits in the recommended time frame? So adding that quality to any service that we're providing. When the BNA dashboards, the bottleneck analysis dashboards, are launched and they are in the DHIS2 and they're living documents, it's a living platform, then the district health management teams will feel really empowered to take decisions without having to laboriously manually populate this information and take days and months analyzing it. So this Gates initiative is going to bring meaningful change with the way implementation is being done. To add on to this, the citizen engagement component is extremely powerful, and we're using the U-report to gauge whether citizens are satisfied, there is client satisfaction with the services. We use the citizen engagement to inform them about important programs that are happening in their communities, and this is really appreciated. The community engagement platform through the U-report exacts community and social accountability. So the service providers have a duty and a responsibility to provide quality health care and nutrition programs and HIV programs and nutrition programs to the communities that they serve. So it's an initiative that has been fairly short. The time frame that has been planned for, that has been planned for it is fairly short, but we've been able to so far achieve quite amazing results. We are looking forward to the next 6 months of implementation, when everything will be automatically generated, and we're also going to have a community scorecard so that the communities can score facilities in terms of, timeliness of opening facilities, for instance, opening times, closing times. Are the health workers there in time? Are they not absent? Are the drugs there all the time? Are there stockouts? If there are stockouts, they have a platform in which they can easily report, and issues like that are addressed on time. We do not want to rely anymore on annual reports to make corrective action. We are using real-time data. We are living truly in the 21st century. Thank you very much.